Hello, beautiful souls, and welcome to another episode of WTF What's the Frequency? And I've got a real treat for you today. I have the genius, Alan Attridge, founder of MyShroom Medicinal Mushrooms, a product that can beat cancer, that can help you beat any sort of chronic illness or disease. This is groundbreaking stuff, so pin back your ears, because if you're unwell or you know somebody that's unwell, this is information that you can't do without. So join me in welcoming the amazing Alan Attridge to WTF What's the Frequency? Hey Alan, how are you doing?
Good. How are you, Vanessa?
I'm very well. I'm absolutely honoured to have you on the show today. Thank you so much for taking time out to join us. Well, I've got so much to ask you, Alan. I'm just going to jump straight in with my first question, if that's okay.
Yes, it is.
Okay. So, Alan, what inspired you to create MyShroom? And how did your personal journey with medicinal mushrooms shape the vision behind the brand?
Thank you. Well, I'm going to give you the short story of our team. One of the teams I work with in agriculture was approached by a team from Taiwan that had a specific strain of mushrooms that when they fed it to animals with tumors, the tumors would rapidly reverse. And so they asked our team to help decipher the why, what, and how. They basically took a fungi of the Ganoderma species that was in the wild, that's growing on soil or dead wood or plants, brought it into the laboratory, and the lead scientist at the time focused on what is called beta-glucan molecules. One, to know if we cultivated this on different substrates, such as fruits, vegetables, or herbs, would it change the beta-glucan molecule and make it maybe more powerful, as well as several other polysaccharides? Well, his hunch was right, but it wasn't until 38 years later that they developed a hybrid by changing substrates from time to time. And when they fed it to the animals, the tumors would go away rapidly. So they asked us to be a collaborator. After reading the science, we then went ahead and we search the globe for others in this collaboration, because reading the science, there's thousands of molecules here, so we need more researchers to participate. There was over 100 institutes, universities doing research on fungi, but we found 6 others that were doing this similarly, also approached it the same way. They took a specific species and changed substrates over a period of time and found that they were more beneficial, specifically with reference to tumor, reducing of tumor growth. So we all started to collaborate. And it wasn't until 2 years later that I was in Switzerland for a 1-week meeting on agriculture, and one of our colleagues from Australia had come in on Friday afternoon and said his best friend had brain and lung cancer, and they only gave him a month to live. So I was sitting at the conference table and said, wait a minute, we have some strains at universities that's been remarkable with tumors. What if we had him consume this? So the next morning I called all the universities and had to send to us, and we put together a formula, and we shipped it to the individual who was in Australia. And we said, based on your pathology, based on your weight, you should consume 32 grams a day, which is about 4 level tablespoons. Put in your food, put in your beverage, eat it. And 5 days later, he called and said he had a lot of energy. And then in 27 days further, his physician called and says, we have a miracle. All the tumors were gone in his brain and lungs.
Wow. Alan, can we just underline that for a second? So 28 days later, he had a reduced tumors in his brain and his lungs just from taking mushroom powder. That's incredible.
But this mushroom powder is a little unique because the spores are unique. We call them designer spores, right? You can't get them in the wild. Secondly is how it's grown. It's grown in a sterile environment. People wear hazmat suits. They don't even breathe the air or the water because you can't contaminate the substrate. You can't contaminate the specimen if you have to do thousands of experiments of extraction. Wow. So I convinced the teams, it took about 4 months, as you know, the bureaucracy of the universities and institutes. But we went ahead and we beta tested this, and we beta tested this over 2 years, and over 800 successes with about a 91% success rate with all types of cancer.
I'm sorry, again, Alan, did you just say a 91% success rate with all types of cancers? And this is people that have been told, you know, get your affairs in order. You've got limited time left on the planet, right?
Right. Now, this is not a cure of anything, anybody. What this really is superior nutrition that seems to supply your body what it does, it really super powerfully increases cell communication. And also components, or I call it elements of the various molecules, attach themselves. They change in the body going through the small intestines. And they attach themselves to those cells in the body that are sick, deformed, cancer cells, benign tumors, lesions, and exposes them to your immune system. Now, as if you want to call it, as a foreign body or a pathogen, and then your immune system consumes it. That's 9 out of 10 times. At least 1 out of 10 times it stops metastasis. And then with all our collaborators in research and science, there's 6 other products that we can add, and so we can have even a greater success for the 1 out of 10. But we call this really a superior nutrition. It has all the essential amino acids, minerals, transition metals that even individuals just could consume this with minerals and water for up to 90 days with no other food at all. It is a superior. It's the most nutritious food on the planet Earth.
That's incredible. So, you know, what you're saying really is that, you know, we've got a cure here for starvation, haven't we? You know, we've got a cure, we've got something to keep people going in the most desperate circumstances when food is short. So this really is a level of nutrition that is really superior to any food that you can consume. This is incredible.
Now, I know there's certain foods that are high in protein and so forth, but the added edge to this is this. Through each oncologist that use this, we kind of, we beta tested it, okay, anecdotally, okay. This was not a clinical trial other than we recorded. Is from physician to physician, we would have physicians. We had one physician, for example, that confronted with a colleague. This was an oncologist. He had another colleague share with him that he had a lady who had an infection from a hip operation. She was 82 years of age. And no antibiotics were working. Nothing was working. So the oncologist said, why don't you try this? We do know that fungi have various, and they're published, various antibiotic molecules. That has been published. So they gave, so we convinced the other physician, why don't you give her 16 grams a day? It was like 8 teaspoons. So after giving her that 5 days, she beat the infection. What a surprise when nothing else worked. They continued to give her 16 grams a day. Then they called us in 40 days. They said, this is remarkable. Her hip is solid. How can a hip heal in 40 days?
I'm sorry, Alan, I've got to interrupt you. So normally in this sort of situation, we're talking hip replacement, aren't we? When it's unheard of that a hip would get better and wouldn't need to be replaced, isn't it?
Well, that's the other thing is we found from time to time since that. So what it is it's basically been physicians sharing with physicians more than patient to patient. And they would find these remarkable outcomes. Or we had another patient who had a biofilm, didn't know he had a biofilm from a parasite. Basically, he was in paralysis in a hospital for a long time, and they couldn't figure out why. And again, an oncologist shared with a physician at a lunch, they met at lunchtime in the cafeteria. He said, why don't you try this? And in a week, that patient was out of bed. Now, we did find out through, infectious disease and a hematologist that he had a parasite that was producing a biofilm in his veins. But what happened is the immune system was supercharged to the point it could break down the compound that was causing the paralysis. Okay. Now, people say, well, this is really supercharging the immune system. Yes, but it also modulates the immune system. You say, how is that possible? When you have better cell communication, the body's telling your immune system, calm down or stop. So those with autoimmune diseases can see symptoms go away, actually, or great improvement. By the time you're 50, 60, 70, or 80, your cell's ability to produce redox molecules and also with hormones, so your cells communicate, has gone down by 60 or 70%. That's why an 80 or a 90-year-old cannot heal like a 20-year-old. But after just consuming this, you see in 30 days, you can see them heal very rapidly. And blood work doesn't lie. And with our physicians, there's markers. We look at the immune system, other than the specific marker or red blood cell count. And that kind of is a measuring stick to share with the physician. Okay, whatever I'm doing, is it working? Okay. There's a lot of unknown here because basically life is a miracle. But those thousands of scientists on the planet continue to do research. Remember, when a new discovery is made in medicine, it can take 20 or 30 years before it becomes a standard of use or a standard of care.
That's almost criminal, isn't it? When you've got something that works over and over again, and that traditional big pharma. I mean, my own sister has had breast cancer. I've been appalled at the suffering she's had to go through to get, better, really, and what she's had to go through and the longevity of that. And what fascinates me about this is you're talking about 28 days seeing an improvement, if not, I know we can't say cure because the black SUVs will turn up and, we don't want that, but we will see incredible positive benefits to whatever the chronic disease is, whether it's cancer or, as you've said, autoimmune disease. This is fascinating, Alan.
Well, we've articulated the science of what we know with all our collaborators, but we've also articulated the hypotheses, and the hypotheses make great sense. So any allopathic physician reads it, or a pharmacist reads it, or a scientist reads it, they will get it. We find many across the globe, when they just take the time to really read the science, they get excited about it. And really, everyone should use this. If not, at least once a year, we have several medical teams say, all of us should just use this for 1 month out of the year as a preventative. Other than because the organism also, what's wonderful about the fungi organism is it excretes chemistry that's very complementary, at least to these strains or these species, to us. Everyone knows Ganoderma is a very natural, and even in the wild, you can pick them and you can consume them. There's nothing poison. But I tell people, if you're going to pick anything or you're going to buy any even food service mushrooms in the store, you should at least steam them, or you should blanch them or cook them. Why? Because they're covered maybe with yeast. Now, you might have heard the terminology, well, if I eat mushrooms, I get candida. That's possible. And now it's been shown that candida is a cause of various cancers. So if you have this cervical cancer, uterine cancer, prostate cancer, bladder cancer, pancreatic cancer, research shows is caused by candida that gets in the mitochondria of the cell. Amazing. And so how do you kill candida? There's been trials here in the US and in Europe where just consuming various herbs like oregano, that you can battle candida. And so I suggest people maybe grow an oregano plant in their garden and eat maybe 5 or 6 leaves 3 times a day. Maybe in 5 to 6 weeks, you kill the candida. So those men who have prostate cancer, but it's borderline or it's an inflamed prostate, it's probably the candida that's causing it. So I said, you go grow some oregano in the garden and consume it.
But Alan, I just want to ask you, my own father died of prostate cancer. He was given 3 months to live and he managed to rock it for another 15 by changing his diet, eating loads of herbs and, making meat just a once a week thing. But I'm very interested in what you said about candida there, because the records show, or the reporting is, in the UK particularly, we've got a huge spike in pancreatic cancer with young women. So this is what's causing it, candida. And if we can target that with the mushroom, the medicinal mushroom powder, you're saying that within 28 days to sort of 40 odd days, they potentially could see their cancers positively impact. I'm being very careful with my words here, Alan.
Well, that's one patient or patients. I mean, after that one incident, we gave it to 3 more cancer patients. We had the same outcome with around 30, 35 days. But I would say everyone's different. Everyone's cancer is different. We've had patients with numerous cancers throughout their body with no chance of survival, but it took them 3 or 4 years to combat it all. It took a long time for the body to really get it, all the cancer, okay? Or at least enough cancer they can live. We've had patients with lung cancer or brain cancer, and the tumor would go away, but then there'd be still a little bit of a tumor the size of a pea still in the brain or still in the lung, still there, but they're living a normal life today, completely normal life. Maybe it's a calcification, well, maybe I should do a biopsy. Not necessarily. When you do a biopsy, you want to kind of avoid it. So what I usually share with physicians and patients is whatever your health challenge might be, even if you're scheduled to go for surgery or chemotherapy or whatever the therapy might be, try this. Your blood work won't lie. So in other words, if you're scheduled for, let's say surgery 30 days from now or chemo, just try this for 30 days and your immune system, the physician and if you have x-rays, you'll be able to see, is there a reduction in the tumor? If there's a reduction in the tumor and the immune system's more balanced, that means it's working. So then you don't need to have the surgery. Then you don't need to have the chemotherapy. Okay. So what do you have to lose by using this for 30 days? What's been remarkable with reference to, we've had men and women that are going to get a knee operation, or they're going to get a hip operation or a shoulder operation. I'm just amazed at how fast the bone and cartilage and tendons regrow, completely regrow. I have orthopedic surgeons jumping for joy saying, I don't have to do any surgery.
Wow, this is just outstanding, Alan. I mean, this is the hope that everybody with a chronic illness or disease is looking for, quite frankly. Because my own personal story, when I couldn't walk and was struck down by debilitating arthritis, Big Pharma offered me drugs that made me less worse, but kept me still ill. This sounds like something that, will actually get people back to normality. I mean, this is incredible. I know I keep saying incredible, but I'm just astounded by what you have to say. Please give us more information.
Well, we call it a miracle. If it wasn't for those over 100 scientists on the planet that spent combined, over 50 years of doing their diligence, we wouldn't have these strains that we have today, or this remarkable food that we have here. And I would hope that in the future, this becomes a standard. And what I'm even finding, because there's great cell communication, and there's a lot of things we don't know, everybody, okay? And any scientist listening, there's thousands of chemical reactions going on in every cell of our body. And there's too many variables, so we cannot accurately compute. So it's a trial and error, experimenting. But I'm just fascinated how fast the body can react and improve. I mean, if you're going to get a heart operation, or if you're going to get a heart valve, Oh, I'm scared to get a heart valve replacement or operation. In a month, the valve is back to normal again. Your own stem cells repaired the valve. So that's what's, and we didn't know, none of us knew this. This is because we have to thank those wonderful physicians who have shared with other physicians on the planet. That's how these were all determined. That's how we determined this had cell communication. I mean, improved cell communication. Number two, the superior nutrition with reference to organs and hormones. And thirdly is modulation of the immune system, strengthening the immune system. It also increases the uptake of oxygen to your red blood cells, maybe by 30%. So even an athlete has more endurance and they recover from the exercise much more quickly. Or we even had marathon runners who were always in third and fourth place, and now they win marathons. And so you say,
oh, this is incredible. I know sports coaches that'll be all over this once they've heard you say that. Because, it's all about an extra 2 seconds, isn't it? That's all you need to be a champion.
So what it is you can see your red blood cells can carry more oxygen. And, you do a blood test, it's proven. So it's all the wonderful, that's getting back to when I said there's some remarkable vegetables and herbs on the planet, but they don't have the combined chemistry. And why did the lady beat the infection? Well, we found that what is called polyamino acid molecules. And polyamino acid molecules, you might have heard the story that people go to you've heard years ago, people say, go to the forest and eat the dirt. The dirt has wonderful things in it. Well, the reason in very fertile forests on the planet, there's fungi growing in the soil, in the roots, and in the forest, and they produce polyamino acid molecules. So if I take a fistful of that soil, there's definitely some pieces of mycelium and tiny fruit body of various fungi. And when I eat that, I'm getting the polyamino acid molecules. And the polyamino acid molecules that we now determined kills gram-negative bacteria. There's 193 gram-negative bacteria in the world, according to the CDC, and there's no cure for any of them. No antibiotic will work. This seems to work every time. So we're going to plan to do a trial on that just alone. So what we really have here in our observations and our colleagues, this is the best antibiotic, or if you want to call it natural antibiotic on the planet. Even if you're allergic to penicillin, it's safe. Even if you're pregnant, it's totally safe. You cannot overdose on this product. The side effects would be is when you first consume this, your first 2 or 3 or 4 days, you're going to have extra energy. You're going to feel, woo, wow, I got a lot of energy. Then it's going to calm down. But what it's doing is it's strengthening the immune system. So now when your immune system is balanced, all the regulatory functions, all your organs, and your nervous system become balanced. And other quotes from up there in Stockholm is, if your immune system is balanced, you may overcome these 5 diseases. Those 5 diseases are Alzheimer's, dementia, schizophrenia, bipolar disorder, and addictions. Now, over the years, we've had different teams on the planet, or researchers or even physicians who do their own little studies. And it's remarkable, of those 5 diseases, we've seen people overcome those 5 diseases. And what's great is this is also wonderful for addiction. We didn't know this. We had a team up in Canada, and they called us and said, this is remarkable. Every single addicted patient, either a gambler or their opioid addiction or alcohol addiction, they're completely off it, but it's like permanent. They have no desire to go back. Even if they smoke, or a chronic smoker, they have no desire to go back and try it again. Why? Yeah, all our cells of our body have memories. They remember. And if they can share their history, what they remember from one to another, it's strong enough to tell your brain, don't eat this, don't consume this. I mean, it's amazing. We have testimonials on that. So in the United States, if you have an addiction and you're going through, like the state of New Jersey had like 80,000 people that were on addiction, 40,000 had to go through detox. Of the 40,000 had to go through detox, they had to take drug therapy during their detox. It's called the MAT program, M-A-T. And that's 5 different drugs that you are prescribed, and that's maybe for a month or two. And the drugs cost between $20,000 to $40,000 a month. But more importantly, is not everyone overcomes their addiction. They have to continue to take something other than counseling. But with this product, you only have to maybe spend $1,000, $2,000 tops, and you can have the same outcome. And it's permanent. I would say 99% of the time it's permanent thus far from all those on the planet. So, I like it when the patients call us and they say, this is the first time, he says, I've had addictions for 30 years. The first time in my life I have complete control of myself. I make a decision now that I'm going to do something, and I do it. And I said, every Wednesday I'm going to go to the gym. I go to the gym. I says, I have so much focus, and this is what the patients tell us. Why, again, everyone? Cell communication. It's proliferating our body's cells to talk to one another greater than anything I've experienced in my life. So anyways, so this really is a miracle, and it that's what's inspired me and all of us and many around the globe now to share this. And I hope it become the standard of use, regardless of what the health challenge might be. And we even have physicians around the globe that say, you know what, I have all my patients use it just for 1 month out of the year as a preventative. We'll have them take a high dosage for 1 month out of the year, because there's 5 or 6 parasites that also can be killed because of the polyamino acid molecules. So you don't have to go through chelation therapy, which is expensive. That trial was done in China. 3 of the strains came from China, just so everyone knows. So this is, again, it's just remarkable. And our focus right now is to expand capacities so we can eliminate famine on the planet. Or if somebody has famine, they can come back to life so much more quicker, and it's the best antibiotic on the planet. Because when you have famine, severe famine, there's disease because of also infection. So we're in discussions with about 110 countries right now and other groups to make this all happen.
That is incredible, because it breaks my heart watching the news, seeing refugees in tents in horrible situations with limited access to clean water and good food. And to think that there's a product that can bring them back to life and good health after all the trauma they've experienced in a war is just incredible. Now, Alan, I want to shift onto the amazing MyShroom chocolate bars, because with so many energy boosting products on the market, what sets the MyShroom chocolate bars apart in terms of ingredients, benefits, and the overall experience?
Well, I want you to know, because you can feel it, you can see the difference in how you feel. And I guess if you ate some chocolate every day and we do a blood test, we definitely could probably see a difference in the blood test. We haven't done that yet, but I'm just saying that part of this is, how do you deliver the product? The best way to deliver this product is add it to a food or beverage. And also we find that with green vegetables or like a sweet potato or potato or rice, when you add the mushrooms, you can actually reduce the dosage by about 25% from the observations taken with physicians and patients. And it gets back to what is called, you've heard of Ayurvedic medicine, less is more. When you add certain things together, it can be less is more. We don't have all the answers, but we can show under a microscope what happens with the various polysaccharides when those from the food are added to the fungi. So we produce a chocolate bar or a cookie, which is the other thing we have, and even a truffle. But the purpose is all you do is have to consume this. Like, we had a little girl who had brain cancer in Atlanta, and we sent 1,000 truffles. And in the truffles, we had the mushrooms, and she ate she ate it every day, and her tumor went away. It was organic, it was gluten-free, it was sugar-free, it was totally healthy. And so that's another way of delivery. You can put it in smoothie, you can add it to juice, you can sprinkle it on your food, you can put it in salad dressing, put it on your salad. And so that's how the chocolate bar came about. We thought about, well, what about a chocolate bar? And those who, again, this is not a cure of anything, but we find even if you're diabetic and you're on insulin, or type 1 diabetic, that over a period of time, maybe 5 or 6 or 7 weeks, you can see you can reduce your insulin intake. And we're trying to figure out, we're going to be doing a trial in LA on this, why. What we all know is beta cell communication. So the body is trying to repair itself. So even if you have a genetic defect, even if you have sickle cell anemia and all the rest, there is an improvement that they can reduce their medications. The body is trying to repair itself, even though they have that defect. Even if you had Down syndrome, you see better communication. Everyone benefits because there's better cell communications. So we have 2 universities in the world that are doing genetic testing. And thus far, they're saying on our experiments, probably all humans on the planet should probably consume 5 grams a day for the rest of their lives, which is 2 teaspoons a day, which is very affordable. Why? As a preventative from preventing a genetic defect from turning on. And because we may have a genetic defect we're not aware of, but that's thus far in their discussions and their experiments.
And Alan, I'm particularly interested because I have an autistic grandson. Not grandson, godson, actually. And, you know, it would be very difficult to get him to consume mushroom powder, but he loves chocolate. And, you know, the thought that a couple of squares of chocolate a day would actually help him to be calmer. He's a teenager at the moment, and it's proving a bit difficult that, you know, when he has his outbursts. But you're telling me if he has a couple of squares of chocolate a day, he will feel better. And then at the other end of the scale, if you're a busy executive and you're tired and you're working 14 hours a day, you know, you get that sort of downtime at about 4 or 5 o'clock when your, you know, blood sugar level drops. Are you saying that a couple of squares of the chocolate would be like having a double espresso without the jitters? Because I'm all over that if you are.
Yes, you're actually true. I mean, when this first thing happened with the first patient and the 3 other patients, we had 4 patients, you know, that overcame, they were able to beat their cancer. I started to take the product myself, and I just took 3 teaspoons a day. And I can tell you in about 3 months what it did to me mentally and even physically, just in 3 months. Wow, what it did to me. Because I remember at the university, you know, it's 3 or 4 in the afternoon, you're mentally exhausted. And I was working on 3 large projects. And after about 3 months, it's like I felt I was 30 years of age again. You know, I was younger. My mental capacity was amazing. Now, what we have learned over time, anecdotally, with several patients and several physicians who've done these trials, or anecdotal trials with their patients, is there is an increase in cognitive ability and comprehension. You know, you would assume so if there's better self-communication. So,
So you're telling me if I start taking this mushroom powder, I'm going to get smarter. I'm going to have greater cognitive function. I'm going to think more clearly and calmly and probably more creatively. That's incredible, Alan. I mean, I can't think of anybody that wouldn't want, anyone that's working, particularly people in high-powered jobs, that wouldn't want that advantage, really.
yeah. And
Now,
I think, yeah, it's, so again, this is, again, we call this really a miracle. So our whole job is provide an education. This and you know, there's dozens. You know, I have a few textbooks that have literally over 2,000 herbs on the planet that have remarkable things that they can do. And as we see in Europe, Asia, South America, Central America, and Asia, they're starting to get into more of the production of these herbs for the purposes of beating disease or helping overcome various diseases, which is great to see. But anyways, the other part of this wonderful thing is when we mass producing more of this fungi, we actually put a lot of people to work. So if I employ 3,000 people, I can save maybe 1 million lives.
what?
And that's a pretty good job, yes.
I mean, you're just running these figures by me, and I'm astounded. That is incredible. I mean, really, this is the new industry, isn't it? Wellness and, preventative medicine in a world where so many people are so chronically ill at the moment. I mean, we've talked about this before. Recently the WAM report has come out, Women's Health Access Matters, and the McKinsey report has come out to say that, if we don't actually start looking at women's health in particular, because women are so chronically ill at the moment and so blindsided by big pharma, who seem to think that we have the same physicality as men, that there's going to be $1 trillion tax deficit by 2040. So this is giving me huge help, huge hope even, and offering real help to women that, really very often, and we talked about this earlier, chemotherapy, a horrific treatment. A lot of the treatments that you're faced with when you're chronically ill are really unpleasant and deliver horrible side effects. So I'm really impressed by the fact that you're saying there's no side effects, you can't overdose, you can take it when you're pregnant, you can take it whatever age you are. I mean, this is phenomenal. So,
well, you can also take this with any drug either, because I mean there is 8 cures and maybe more of drugs that do work, everybody, but that doesn't mean those 8 will work for the other hundreds. So the other part of what we do is we also collaborate with the medical team and the patient, to help brainstorm on better diagnostics or better treatments in general. Because mushrooms might not be the answer to everything, but it should be part of the protocol, or should be part of the toolbox that a physician uses. But as we, it's amazing how we were created. Remember, we're a miracle. Life is a miracle, but it's amazing that our body, you just give it the nutrition that it needs, and a little bit of cardio, a little bit of weightlifting, a little bit of exercise, that your body's chemistry balances, becomes efficient, and we can repair itself quite quickly. You would say, well, do we need to have vaccines and do we need to have drugs? Well, there's some, but that doesn't mean, I think it's a little overboard. I think it's getting back to nutrition. Remember, the cause of disease in the world is malnutrition, which doesn't necessarily mean calories, but it means minerals and vitamins. And our food has been depleted. If we go back to our grandparents, the great-grandparents, the food and the soil was cleaner, wasn't contaminated, the air was cleaner, and all the other things. So we haven't been getting, and we can go back to glyphosate that came from Roundup. It contaminated our food for 30 years in North America. It's a lot of poisons. And so, but there's a big trend, everybody, and even in medicine, on the focus of nutrition. I see in nursing schools and medical schools across the globe, they're added a lot more nutrition courses, getting back to I call it the basics. So that's good news.
very interesting, because I live in an agricultural area, and we're obsessed with soil quality. Frankly, here it's all anybody. It's what you hear people talking about in the pub. It's quite funny, but the emphasis really is on eradicating the pollution that you've just highlighted. Now, I know I've got limited time with you today, so I want to move on to my next question. How do you envision medicinal mushrooms evolving within the wellness industry? And what role do you see MyShroom playing in that?
Well, I think, as I said earlier, it should play a role in nutrition, definitely. It should be part of our diet for a period of time, and maybe on an ongoing basis. We were planning at 5 universities to do many trials, and that was stopped because of COVID, and we're going to start trial those again. Why do we see somebody who's been on kidney dialysis, who's been on kidney dialysis for 20 years and now off of kidney dialysis? How is that possible? Why is the body able to repair the kidney? Well, it happens. And it takes a long time, I want you to know. I mean, some of our kidney patients, it took 5 or 6 years of taking mushrooms to, so that's that's one of the most difficult in repair in our observation. But we're working with several kidney teams at 2 universities. I'm going to be doing more experiments. I'm sorry to get off on a tangent on kidney disease, but when we talk about repair, that I just mentioned, that's one of the toughest to repair, other than all the other organs and bone and muscle and even brain injury. Is the kidneys is the there is improvement. It's a long process of improvement.
So really, what we're saying is that MyShroom and the amazing product that you've developed has these incredible miracle results with all sorts of chronic diseases and illnesses, infections. I appreciate you being honest and straightforward about kidney disease. And I know that you always only talk about things that have scientific data behind them. So, there's nothing wishy-washy about this or anecdotal. We've got hard science behind it. And the fact that you mentioned so many doctors are actually changing their view and seeing that this is a miracle cure and recommending it to their patients is amazing. So I think that, one of the things everybody should be taking on board is the fact that very often our nutrition isn't good enough to keep our bodies healthy. Something else that you said earlier was very interesting, that our cell communication really starts to drop off once we get to 40. And it's something that we just don't talk about. A lot of people talk about wanting to live to be 100 or 125. And, is this a product that could help us with that?
Yes. Well, I have to get into another meeting, actually. I just realized the clock.
Okay.
So so let me, well, thank you for the interview and questions here. And the other part of this is we just sell mushrooms or sell these strains. And remember, these strains are not available from anyone. They're grown in a sterile environment, so there's actually no waste. When we grow the mushrooms, we make sure that all the substrate is consumed, because what we grow it on agar screens. So basically, all the agar and all the other substrates are completely consumed. So all you get is fresh, moist mycelium. And the way we do it is we make sure that we baby this organism. So the majority of the molecular structure is the weight and size of the molecules are small and very bioavailable. So at the end of our grow, we don't have to do an extraction, which is also unusual in this industry. And I want to share that hopefully with a lot of growers of mushrooms in the world, so they can actually improve on growing mushrooms in general, specifically for nutraceuticals.
That's fascinating. Again, Alan, more fascinating information. So thank you very much. I'm aware our time's come to an end. So have you got any last points you'd like to hammer home to people before we sadly have to let you go?
Well, one little thing, everyone, and all the patients and physicians we work with in the world, we find that many times there's a shortness in oxygen, especially when autism or neurological disease, Huntington's, lymphoma. We find that Parkinson's. I would suggest that the family member or the patient carry around an oximeter with them. So I'm talking autism, children with autism, even the epileptic patients, any neurological. They should carry around an oximeter and to see if their oxygen levels are getting lower than 93 for more than 5 minutes. Then they should dial 911 and get an oxygen tank. We've had patients that have had these challenges for decades. And I can tell you a lot of the problem was oxygen, believe it or not, and it's missed. It's missed. Why does your husband, or why does your wife, or why does your child blow up and be extreme anger? You know what? It could be just oxygen, everybody. So carry an oximeter around, you put it on their finger right now, and if it's low, you call 911. That's a signal, okay? So that was the last to add to this.
Alan, I can't thank you enough for this genius that you've imparted with us today. I thank God that you are on the planet and working on this incredible product, MyShroom, everybody. And I can't thank you enough for being here. Please, will you come back and share your knowledge with us again very, very soon?
Will do. Thank you.
Okay, thank you so much for joining us today. That was Alan Attridge, founder of MyShroom, imparting his incredible knowledge. Thank you, thank you, thank you, Alan. And I'll see all of you very soon. Thanks for joining us on WTF today.